It has been almost a year since the first case of coronavirus made its way to the United States. Since then, scientists all over the world have raced to find a vaccine for this deadly disease. On Thursday, the FDA will hold an emergency use authorization hearing for 2 COVID-19 vaccines. In the first for a series on the vaccination distribution plan, ABC 7's Judy Alley takes a closer look at these 2 vaccines and why medical experts are hopeful they could eventually put an end to the pandemic.
And it didn't hurt a bit.
Maybe not the shot, but the pain brought on by polio was severe.
There were thousands of children on iron lungs, children dying of polio, children who couldn't walk, and there was no antiviral treatment.
Summertime seemed to be the worst, and that was the time we were out of school. The days were long, you could play late. Parents wouldn't let us. They were scared to death.
Roger Gray was 6 years old in 1955 when nearly 3,000 people died of polio. It was also the same year the first polio vaccine, created by Dr. Jonas Salk, was approved for use.
And then they told the country we were going to start inoculating children first because so many of the victims were children. The relief was unimaginable. They lined us up and they did it at school because that's where the kids are.
The results were dramatic, and as everybody knows, eventually polio was wiped out.
It took years and years of research and testing before the polio vaccine was ready, which is the case of most traditional vaccines. But today we're dealing with a disease that is anything but traditional.
So this is an even more severe emergency situation from a viral infection.
With more than 1.4 million deaths worldwide in less than a year, scientists have been working at a furious pace to create the first vaccines for SARS-CoV-2, better known as the novel coronavirus.
Just like the human body has arms and legs and heads and all different body parts, a virus also has lots of different parts as well. But there's one key critical part to the coronavirus, and that's that spike protein.
2 promising vaccines, one from Pfizer Pharmaceuticals and the other from Moderna, are awaiting emergency approval from the Federal Food and Drug Administration, which could come in the next week or so.
It's a really remarkable technological leap. Now, obviously, it's not something that people just came up with 6 or 8 months ago. This is something that there's years and even decades worth of background work that's gone into this concept.
We have an opportunity now, like we did for smallpox and like we did for polio. Now we have the opportunity for science to again have this incredible triumph over COVID-19.
Preliminary results of both the Pfizer and the Moderna vaccines report a 90% or higher efficacy rate in most people, with mild side effects including fever, headache, and body aches. However, there are unique challenges the coronavirus vaccines pose. Both require 2 shots spread out over a few weeks. Both vaccines also require cold storage. The Moderna vaccine can be stored in a regular freezer after delivery. However, the Pfizer vaccine requires much cooler conditions.
That's minus 70 or minus 80 Celsius, which is about 100 degrees below 0 Fahrenheit. And that kind of limits the ability of some places to be able to store it for very long.
Universities, like Texas Tech here in Amarillo, do meet the strict requirements for storage and will house initial deliveries of the vaccine until hospitals and clinics have their own capability to provide sub-zero safeguards. But health experts warn the biggest challenge to making this medicinal mission a success will be persuading anti-vaxxers and skeptics to get the vaccines.
They need themselves to look at the history of infectious disease and see that vaccines is the most important thing that has ever come up in science, maybe with the exception of sanitizing water, the most important thing that's ever come up to stop infectious diseases.
Now, 65 years after he was inoculated with the then new polio vaccine that ended up saving many lives, Roger says he will again take a shot at trusting science.
Yeah, I'll get the shot. Because as you say, I'm just as vulnerable now as I was in first grade.
Hoping successful medical history will repeat itself. In Amarillo, I'm Judy Alley.